صامدين معانا للوجبة الدسمة في مؤتمر بروفيسور سناء عن النوتريشن. بإذن الله دلوقتي هقدم بروفيسور راندا رضا، أستاذ كلينيكال باثولوجي والتغذية الإكلينيكية، هي رئيس بروجرام الفيمر فور ميديكال إديوكيشن. حضرتك شرفتينا وكلنا أذان صاغية. دكتور راندا هتكلمنا على بيرن اوت Nourishing Mind and Body of Preadolescent Athlete. ميرسي يا دكتور راندا مقدما.
شكرا. بسم الله الرحمن الرحيم. طبعا في الأول لازم أشكر الأستاذتي الغالية الدكتورة سناء على دعوتها ليا أن أنا أكون معاكم النهاردة، فدي بالنسبة لي شرف كبير قوي. وبشكر طبعا ياسمين واللجنة المنظمة على دعوتهم أن أنا أكون معاكم، وإن شاء الله مش هطول عليكم، الموضوع هيبقى خفيف. Related to the adolescent or pre-adolescent athletes. ممكن حد يجي يساعدني بس لسه. ايوه، ما هو انا مش عارفه اشتغل. اوكي. So from burnt out to balance, nourishing the minds and bodies of pre-adolescent athletes. My talking points would be introduction, nutritional needs in a glance, understanding the challenges, including the nutrition knowledge, the burnout athletes, the supplements, and a case for thought. Last few years ago, Dr. Sanae has asked me to present a talk about the nutritional needs for adolescents. So today we are going to talk about it from a different point of view regarding the different challenges which meet the parents, the coaches, and the physicians as well. So my objective is to unleash the winning edge for the thriving minds, the supreme health, and the peak performance of these adolescent athletes. You know how much this is challenging. The nutritional considerations for the adolescent athletes have been delivered through many studies. And every year, these studies get out new subjects about the position statements regarding the sports nutrition for the adolescent athletes. Because, of course, you understand that physical activity and exercises and sports are very important for this group of patients, for this group of at this age since childhood going through pre-adolescence. If we are going to talk quickly about the nutritional considerations, we have to mention the nutritional assessment and how to determine the total energy needs, the carbohydrate needs, the protein needs, fat needs, and the hydration needs. So the nutritional assessment is very important for the group of athletes during the childhood and during the adolescent period. And of course, we have to pass through the anthropometric assessment, the biochemical assessment, the clinical assessment, and the dietary recall. Total energy needs are usually done by certain equations, putting in consideration the weight and the age of the and the sex of the individual. And these are examples of the energy expenditure for the females and the males that were adopted by the, one of the national academic institutes from the age of 10 till 18, and depending, of course, by multiplying this by the physical activity level. The carbohydrate needs also depend upon the intensity and the timing of the exercise that these individuals pass through regarding the hours of the exercise from 0 to 1 to 2 hours, and up till 4 hours. The protein needs also depend upon the weight. It also depends upon the intensity, and the ingestion of the proteins also is very important regarding the timing and the distribution of the proteins along the day. The athletes during this age need more protein, and this is well known among all the physicians, among all the parents, and among the coaches, but sometimes it exceeds the recommended daily allowances. But actually it may be from 1.2 to 2 grams per kilogram. We don't have to worry about the fat needs, although we always look for the unsaturated fats more than the saturated fats and the trans fats, but still the saturated fats are needed for the build of the hormones. I won't discuss with you what kinds of fats or what kinds of carbohydrates during this talk that are advised for this group of athletes, but at the same time, I would just give you some tips regarding these situations. Hydration is considered to be a driving force, and also hydration is important, and the athletes should be educated early since childhood of how they will determine their state of hydration, including for example, they have to watch out how the number of the quantity of the urine, the color of the urine. They should weigh themselves every morning to understand whether they are hydrated or dehydrated, and they have to learn when to weigh themselves before and after the exercise. We all understand that the commonest deficiencies among the adolescent athletes lie in 3 minerals or micronutrients, and these are the vitamin D, the calcium deficiency, and the iron deficiency. And in this context, I'm not going to talk about the deficiencies among you, because it is well known among the pediatricians and the professors regarding the iron deficiency for the female athletes, and the vitamin D3. We all understand that the vitamin D deficiency is very common in our country and in the MENA region as well. So this is a case of Mena. Mena is 14 years old. She is a squash player. Her parents are very much involved, as all parents are obsessed with their children in food preparation. But from the nutritional assessment, she had very few sources of calcium and vitamin D in her diet, and she did not drink milk, consumed yogurt only once on occasions, and avoided cheese. So Manna came into the office suffering from ankle fracture, and this was repeated. So this is very much with the nutritional deficiencies of vitamin D and calcium. Now we have to talk about the challenges and understand these challenges among the pre-adolescent athletes. The first challenge is the nutrition knowledge. And the second challenge, which we all know about, is the supplements. And the third challenge is being burnt out. Let us discuss this very quickly. The nutrition knowledge has been assessed and has been investigated in many studies along the years, and this study was done 1 year ago, and many of these studies had been delivered to understand whether the athletes, the coaches, and their parents know much about the nutrition during this early age, and how would they deal with the nutritional problems, and how would they understand it. So nutrition knowledge is very important because it is the power. And it is very important to implement the nutrition knowledge during the early years. For example, many children, at 5 or 4 years when they go and exercise, their coaches ask them to go and have a break and drink water. So this is implemented since childhood. It is not implemented after that. So this is a paper that was, or a study that was delivered in 2023 in Canada, and it concluded that the lower energy expenditure in athletes have been recorded, and it has also been recorded that they increase the supplement intake with higher protein intake. And they attributed the fact that this is not the right thing for all the athletes during the adolescent stage, because they didn't have the proper nutritional knowledge and education. So the early education about nutrition is very important, and the knowledge is a power. Again, we do have Zain, who is a 15-year-old player. He complained of fatigue and headache during the practice, and his mother was concerned. Always the mothers are there watching their children playing, because he was having trouble getting through the practice without feeling very ill and fatigue. He explained that he drinks very little, and he was only permitted to drink when he performs well. And this is an actual case. Apparently, water was his reward for performance. And then we have to decide that ignorance from the coach can lead to catastrophic impact on both the physical and the mental healing. Now we come to the third very important subject, which is the use of the supplements, and many researches have been done in this area, and the importance of the supplements is that they are not FDA approved. And as we know, the supplements may be nutritional supplements, which consist of diets and ergogenic aids that they may consist of nutrients, but at the same time, they don't consist only of nutrients, they consist of other things. So conflicting results in this matter have been released, because not all the athletes, they tend to reveal that they take a lot of supplements in this area. This paper was released in 2022, and it indicated that the protein, the creatine, and the dieting supplements, and it is, we can all see this among our adolescents and children, are the commonest supplements that are taken by the adolescent athletes. And they concluded that the intake of protein supplements may give way to the steroid intake, and it's not, although it seems to be safe, but we are not very much concerned or know that whether they are contaminated or not. And they advised that if we are going to convince our adolescent athletes not to take supplements, it's not to tell them that it's not good to take supplements, but they advise that you shouldn't take these supplements because we don't want you to end like this person, and we can tell them stories that revealed that these persons have been not feeling well, or have been diseased, or even died of the taking of these supplements. So we come to the third challenge, which is being burnt out, and its association with diet and children and adolescents. What is the burnt out? We all understand about burnt out for the adults and for the people who are working and for the physicians and so on. And burnt out is also present there in the area of the athletes, because it is in context of this sports practice can be defined as a syndrome consisting of emotional exhaustion, physical exhaustion, sport devaluation, and reduced athletic accomplishment. And this is, of course, due to the overdoing of the exercise, It may affect, it may be due to the nutritional deficiencies of micronutrient deficiencies or even macronutrient deficiencies. For example, some of these adolescents, they follow the keto diet and so on. And strange enough, it was found that these children, they suffer from burnt out because they not only exercise a lot, but they have a lot of time in front of the screen. So we have here a case, a case for thought, and this is Adam. It's a life case scenario. Adam is a 14-year-old swimmer. He swims with the club team and competes regularly. Several months ago, Adam decided to cut out all junk food from his diet in hopes of improving his swimming performance. He lost actually 30 kilos in 6 months and suffered from episodes of recurrent respiratory infection after each competition. His mother and coach were concerned about his weight, muscle loss, and recurrent infection. And of course, Adam was open to eating more food to keep his weight and strength stable, but was unsure of how to do it in a healthy way. Of course, Adam was subjected to nutritional assessment, as has been mentioned before, and then followed by the nutritional assessment, there is the nutritional diagnosis, which is the problem, stating the problem and the etiology of this problem and the signs and the symptoms. It was, he was diagnosed by having, of course, decreased total caloric and macronutrient intake due to the intentional stopping of many food items because he thought that these food items might affect his intake of the calories, and also as manifested by recurrent infection and increased weight loss. The other statement includes the open window phase, which he has suffered from it twice after each competition, because that the exercise induced immune suppression, and this is the immune depression after the active exercise that occurs after heavy endurance competitions. And these competitions lasted for a long time because he used to swim for long distances, more than 90 minutes, and this was associated with a window phase in which there will be suffering from respiratory infection. Also, low energy availability was diagnosed. So what is the energy availability for an adolescent athlete? It is well known that this is the amount of the ingested energy that remains after the performance of the exercise. And this ingested energy during the period of the growth is responsible for the growth of the athlete, is responsible for the building of the immune system, is responsible for the locomotion, the thermoregulation, and so on. And if it is not there, there will be deficit in the growth of this adolescent. It is usually calculated by subtracting the energy expenditure during exercise from the energy intake of this athlete, adjusted for the fat-free mass. And therefore, we usually use this equation to determine whether this athlete has a proper energy availability or not, and it should be more, for example, as 45. It's just a number. He was giving I'm not here to tell you about the nutritional intervention because I understand that all of you know about it, but he had his proper nutritional intervention and he felt well again. So thank you very much, and wish to see you again. Thank you.
نشكر حضرتك جدا يا دكتور. محاضرة